Are you or someone you know struggling with opioid addiction? Understanding your treatment options is the first step towards recovery. This video provides a detailed overview of Zubsolv, a medication used to treat opioid dependence, empowering you with the knowledge you need to make informed decisions. Zubsolv is a sublingual tablet containing a combination of buprenorphine and naloxone. Buprenorphine is an opioid partial agonist, meaning it binds to the same receptors in the brain as other opioids, but produces a weaker effect. This helps to reduce cravings and withdrawal symptoms without the intense high associated with opioid abuse. Naloxone is an opioid antagonist. It blocks the effects of opioid medications, preventing the feeling of well-being that can lead to abuse. The combination of these two medications makes Zubsolv an effective tool in managing opioid addiction. Zubsolv is specifically designed to treat opioid addiction and is not approved for use as a pain medication. It's crucial to use it only as prescribed by a healthcare professional. Zubsolv carries important warnings that you need to be aware of. Misuse of Zubsolv can lead to addiction, overdose, or even death, especially if taken by someone without a prescription. It's vital to use this medication responsibly and under the guidance of a doctor. Taking Zubsolv during pregnancy can cause life-threatening withdrawal symptoms in the newborn. If you are pregnant or planning to become pregnant, discuss the risks and benefits of Zubsolv with your doctor. Combining Zubsolv with alcohol or other drugs that cause drowsiness or slow breathing can be fatal. Always inform your doctor about all medications and substances you are taking. Before starting Zubsolv, it's essential to inform your doctor about your medical history. You should not use Zubsolv if you are allergic to buprenorphine or naloxone. Tell your doctor if you have ever had tooth problems, breathing problems, sleep apnea, an enlarged prostate, urination problems, liver or kidney disease, or abnormal curvature of the spine. Also, disclose any problems with your gallbladder, adrenal gland, or thyroid, a head injury, brain tumor, seizures, or a history of alcoholism or drug addiction. If you are pregnant or breastfeeding, discuss the potential risks and benefits of Zubsolv with your doctor. Opioid use during pregnancy can cause the baby to become dependent on the drug, leading to life-threatening withdrawal symptoms after birth. Always take Zubsolv exactly as prescribed by your doctor. Follow the directions on your prescription label and read all medication guides carefully. Never take Zubsolv in larger amounts or for longer than prescribed. Zubsolv comes in a blister pack. Remove one single blister unit by tearing along the perforations. Fold the single unit along the dotted line. Do not push the Zubsolv tablets through the foil, as this could cause the tablet to break. Use dry hands when handling Zubsolv sublingual tablets. Place the tablet under your tongue and allow it to dissolve slowly. Do not chew or swallow the tablet whole. If you switch between medicines containing buprenorphine, you may need different doses. Follow all directions carefully. Do not stop using Zubsolv suddenly, as this can cause unpleasant withdrawal symptoms. Rinse your mouth with water after the Zubsolv tablet dissolves. Wait 1 hour after the medicine dissolves to brush your teeth to prevent damage to the teeth and gums. Regular dental checkups are crucial while using Zubsolv. Never crush or break a Zubsolv sublingual tablet and inhale the powder or mix it into a liquid to inject the drug into your vein. This practice has resulted in death. Store Zubsolv securely in its original blister packaging at room temperature, away from moisture and heat. Discard empty blisters in a place children and pets cannot get to. The dosage of Zubsolv varies depending on individual needs and the severity of opioid dependence. The induction phase, which is the initial period of treatment, involves starting Zubsolv when objective signs of moderate opioid withdrawal appear. For those dependent on heroin or other short-acting opioid products, initial doses should begin no less than 6 hours after the last opioid use. On day 1, the dose is typically up to 5.7 mg per 1.4 mg sublingually, divided into smaller doses administered in 1.5 to 2 hour intervals. On day 2, the dose is usually 11.4 mg per 2.9 mg sublingually as a single dose. Maintenance treatment begins on day 3. Doses are adjusted to a level that holds the patient in treatment and suppresses opioid withdrawal signs and symptoms. The recommended target dose is 11.4 mg per 2.9 mg sublingually once a day, with a dose range of 2.9 mg per 0.71 mg to 17.2 mg per 4.2 mg. The maximum dose is 17.2 mg per 4.2 mg per day. If you miss a dose of Zubsolv, take it as soon as you remember. However, if it is almost time for your next dose, skip the missed dose and continue with your regular dosing schedule. Do not take 2 doses at one time. Avoid drinking alcohol while taking Zubsolv, as dangerous side effects or death could occur. Also, avoid driving or operating machinery until you know how this medicine will affect you. Dizziness or severe drowsiness can lead to accidents and injuries. Like all medications, Zubsolv can cause side effects. Get emergency medical help if you have signs of an allergic reaction, such as hives, difficult breathing, or swelling of your face, lips, tongue, or throat. Opioid medicine can slow or stop your breathing, and death may occur. Call your doctor at once or seek emergency medical attention if you have any problems with your teeth or gums, weak or shallow breathing, a lightheaded feeling, confusion, loss of coordination, liver problems, or symptoms of opioid withdrawal. Common side effects of Zubsolv may include dizziness, drowsiness, blurred vision, nausea, vomiting, constipation, headache, back pain, fast or pounding heartbeats, increased sweating, or sleep problems. Zubsolv can interact with many other drugs, potentially causing dangerous side effects or death. Be sure your doctor knows if you also use cold or allergy medicines, bronchodilator asthma/COPD medication, diuretics, medicines for motion sickness, irritable bowel syndrome, or overactive bladder, other opioids, sedatives, drugs that make you sleepy or slow your breathing, or drugs that affect serotonin levels in your body. This list is not complete, and other drugs may interact with buprenorphine and naloxone. Always inform your doctor about all medications, vitamins, and herbal products you are taking. Several alternative medications are available to treat opioid use disorder. These include buprenorphine, Sublocade, Probufene, Subutex, buprenorphine and naloxone, Bonavail, Suboxone, Lofexidine, Lucmyra, Methadone, Dolofen, and naltrexone, Vivitrol. Naloxone, Narcan, Cloxado, is available for opioid overdose in an emergency situation.